Well, hello, it is Dave Hompes again, Hompes Method Practitioner Training. Looking at the fourth introductory video now, carrying on in our explanation of why health deteriorates and disease manifests with a video that I'm calling the Olympic Rings Health Analogy. So let's dive straight in and discuss one of the biggest problems that we see in Western medicine, which is namely the compartmentalization of the body. Now, if you read The Disease Delusion by Geoffrey Bland, who's one of the forefathers of functional medicine, you'll see a really neat little section that I've kind of summarized in the next 5 or 6 slides about the development of the current medical model, basically. And he says that not so long ago it was kind of common belief that bad air caused disease, literally breathing in sick air. And we're not going back very far here, only maybe 130 years, 150 years, when doctors were still kind of telling people they were ill because they were breathing in bad air. And from Wikipedia, you'll see something called the Miasma Theory or the Miasma Theory or the miasmatic theory, which basically held that diseases such as cholera, chlamydia, or Black Death, the plague, were caused by miasma, which is ancient Greek for pollution. And it was thought that it was a noxious form of bad air, also known as night air. The theory held that the origin of epidemics was due to a miasma emanating from rotting organic matter. And so the treatment for conditions associated with these kind of bad air diseases revolved around telling people to go and live somewhere else. And as crazy as that sounds, we can still learn a lot about that, or get a lot out of that if we choose to, because some people do need to go and live in different places in order to optimize their health. And they may need to work in different places. They may need to change their environment completely. But back then, we didn't know what we know now. And really, it was just like, well, if you've got a disease, you've got to go and live somewhere else. It was really crazy. And during these times, life expectancy was only around 40 to 50 years. It was about 47 years in the USA, for example. You had situations where mothers and babies died during the birth process, and people were kind of living in fear of all these different epidemics, pandemics, plagues, and what have you. It wasn't a particularly nice place to be for that in that context. But before the 19th century was over, so late 1800s, scientists like Joseph Lister, Robert Koch, Louis Pasteur, and certain others would revolutionize the way illness was perceived, and in turn completely transform the way medicine was practiced. Now, the germ theory that these scientists elucidated advanced the idea that microscopic organisms, not vapors in the air, caused these, what we now know are infectious diseases. And once the particular organism causing a specific disease was identified, the body could be immunized against those organisms. And Geoffrey Bland says the theory gave rise to what we would today call a paradigm shift in the healthcare universe, the bacteriological revolution. Everything changed. Medical training, surgical techniques, standards of sanitation, and public health. And a whole new industry was spawned, the pharmaceutical industry, with its steady stream of vaccines for immunization, and throughout the 20th century of antibiotics, which are drugs that could treat infections for which there were no immunizations. And in the United States alone, life expectancy rose from 47 years in 1910 to 74 years where we're sitting presently, thanks to germ theory and the paradigm shift it brought about. So when you look back at the medical system, you look back at the pharmaceutical industry and the vaccination and what have you, and you look at the benefits that accrued as a result of that medical revolution, that paradigm shift. We, as people living now in the 21st century, owe almost our existence to the ability of the pharmaceutical industry to develop antibiotics and vaccinations. And the reason I bring that up is because you will see a lot of natural healthcare practitioners, people who are totally black and white. They think that you should only do natural healthcare. There's no room for the medical system, or what we would know as the conventional medical system. And this is nonsense. There's a room for both approaches. The goal of the Hompes Method is to teach people what the benefits and drawbacks are of each approach in a scientific way, backed up with common sense and clinical experience. So I would suggest that you don't ever criticize the medical system, because despite the weaknesses that we all know it has, it is absolutely necessary. It has contributed largely to an improvement or an increase in life expectancy of 27 years, 47 to 74. And so you and I would probably be looking at, I'm 40 years old now, going back into the 1800s, I'd have been thinking, crikey, my time's up now. I'm 6/7 of the way through my my time here on Earth, and that's crazy. So let's not get into the situation where we're bad-mouthing doctors, we're bad-mouthing the medical system, we're bad-mouthing antibiotics, we're bad-mouthing vaccinations, because they created a phenomenal paradigm shift in the turn of the century between the 1800s and the 1900s. Now, I'm not saying that those approaches don't have weaknesses, and that's what we're going to talk about now. But what I am saying is that it's folly, really craziness, in my opinion, to really badmouth it too much. Now, the germ theory taught medics that they could basically isolate a bug and then throw antibiotics at it, or they could create vaccinations against the bugs, and the patient would get better. And that's kind of the name it, blame it, tame it philosophy. Name it, blame it, tame it. And while immunizations and antibiotic treatments have made infectious diseases much less prevalent and less frightening, chronic diseases have become more and more prevalent because people are living longer. So I'll say that again. Chronic diseases have become more and more prevalent because people are living longer. People are not getting wiped out at a young age by infectious diseases. So people are living a lot longer now. And that then brings the challenge. So the longer people live, and the more our environment has changed with food and pollution and stress and what have you, the more chance we have of developing chronic symptoms, chronic illness, chronic disease as a result of living longer. So chronic diseases are basically all those illnesses that make people sick and then they never really go away, or they come back again. It's not their nature. Their nature is to hang around, to stay, or when the symptoms or the disorder kind of looks as though it's gone away and you think, wow, I'm free again, I feel good, the symptoms come back. They may come back worse, or different symptoms might come back and replace the original ones. Now, the problem with these symptoms and illnesses and diseases, these chronic ones, is that we can't zap them with drugs the way we can zap obvious infectious diseases. So one way or another, they end up enfeebling a lot of people, disabling a lot of people, reducing people's quality of life, because we cannot name them. We can't really blame them, we can't tame them. There's nothing really there to name, blame, and tame. Now we go back to the seesaw, the Hompes Method seesaw, and we know that the chronic symptoms and diseases are usually, the majority of the time, caused by too much bad stuff being in the body and not enough good stuff. But you can never pin it down to one thing. There are dozens of chronic bad bugs that can get into the system. There are hundreds, well, thousands of chemicals. There are dozens of nutrients that can become depleted. There's 1,000 or more species of good bacteria in the gut and other microorganisms that can become depleted. There are lots of different bad foods. There are lots of different good foods. And so actually pinpointing chronic symptoms on one or two of those factors is virtually impossible. So there's no way we can name, blame, and tame something for most of the symptoms and diseases that people are experiencing in the 7 areas of health: digestion, sex and reproduction, energy, aches and pains, mood, sleep, and then skin. Now, because they can't be named and tamed, chronic symptoms and diseases have led to an evolution in medicine towards specialization, through which more and more is known about less and less. So more and more, wouldn't you agree, is known about less and less. When you look at one area of the body and you keep honing in on it, look at the eye, look at the iris, look at the pupil. The more focused you get on one small area of the body, the more you miss the bigger picture. And it's very important, in my opinion, to teach clients and patients about this much bigger picture, because the pharmaceutical system, the industry, is going to try and teach them that if they have pain in their leg muscle, they're going to take a drug for reducing pain in the leg muscle, right? It's that name it, blame it, tame it philosophy, but it doesn't work for chronic symptoms, because the pain in the leg muscle might be due to dehydration, or it might be due to a nutritional insufficiency, or it might be due to something else, right? But we try. We have highly trained specialists who provide what you would really say is really laser-focused attention on patients' problem areas. So if you have heart disease or problems with your vascular system, you go see a cardiologist. With skin, it's a dermatologist. With your joints, it's a rheumatologist. With your nerves, it's a neurologist, immunologist, gastroenterologist, endocrinologist, gynecologist, hepatologist. So many different ologists focusing on each area of his or her specialization, each area of the body. So did these experts know a lot about the areas of the body in isolation, the ones that they're highly trained in? Of course they do. They're absolutely brilliant people, and we really need them. But do they know how their part of the body, their ology, affects the others? And in the vast majority of cases, unfortunately, the answer is no. They know how the cardiovascular system works if they're a cardiologist, and the heart, and they know how to keep people alive once they've had a heart attack or, for example, a stroke. But they do not know how the gut affects the vascular system. They don't know how the immune system can affect the vascular system, and so on and so forth. And that is why I created something that I call the Olympic rings health analogy. This is a really neat little tool, another one to help explain to your client or patient how different parts of the body, different systems of the body, all link together to potentially create symptoms. And if one system is out of balance, all the other systems can fall out of balance as well, because all the rings in the system are joined together. And the main systems, the main four systems that we look at, are the hormone system on the left, the digestive system, the detoxification system, and the immune system. When those four systems fall out of balance, then you'll tend to start to have problems in the heart and the cardiovascular system, the lung, the pulmonary system, the neurology of the body, the musculoskeletal system, and what have you. In the red ring, unless there's a physical trauma or some kind of definite, obvious genetic problem, you will not generally find that the red ring has problems unless the blue, yellow, black, and green rings fall out of balance first. Now, just to give you an example of how all of this fits together, this is why the Olympic ring system is so useful, just to explain this to your clients and patients. So look at the hormone system, and what we know from the way that the body works is that the hormone system responds to signals from the nervous system. The nervous system's in the right-hand red ring, but when you sense something, let's just talk about the stress response, for example, which is central to functional medicine, central to the Hompes Method. When you perceive stress, your nervous system transforms the signals or the input that you're receiving from your external environment, and it creates nervous impulses which then trigger the release of hormones from certain glands and organs, particularly the adrenal glands, for example. If you have a brick suddenly fly through your window and you're trying to get to sleep, and then you look out and there's a couple of masked men outside, you're going to go into the stress response more than likely. Well, it's your nervous system that kicks that off, and then the hormones respond. So you've got a nervous system that then triggers hormones. And with the nervous system, the hormone system controls digestion, detoxification, and to a large extent, immune function. So now, if you have hormonal imbalances, you're going to get imbalances in digestion, detoxification, immune system, and what have you, because they're all linked together. All of the blood that drains from the digestive system in the yellow ring there drains into the liver for filtering and detoxification. All paths from the gut lead to the liver. So what will happen if you get an overwhelmed gut with lots of bad bugs living in it and you're eating food with lots of toxins? then it's going to potentially overwhelm the liver because everything drains into the liver from the gut. So the body then has a difficult time detoxifying itself. Now, of course, the digestive tract itself is an organ of detoxification as well, because that's where you poop. So you've got a two-way flow there. The gut can toxify the liver and then the rest of the body. At the same time, it's responsible for getting rid of toxins from the body. So if there's a compromised liver and gallbladder, then the digestive system is going to struggle and suffer as a result of that. Toxins that are not properly dealt with by the detoxification system, so you get a bunch of toxins all running around the body now, can then start to affect the hormone and immune system, which can basically then ultimately affect everything else. Because if you've got a global imbalance in hormones, a global imbalance in the immune system, anything and everything has the potential to manifest, right? So toxins particularly affect the neurology of the body. They affect the endocrine system, the hormone system, and they affect the immune system. That's what many of these toxins do. They target those three areas of the body. Now, if that's not enough to prove kind of linkage between all the different rings here, then this one surely is, because scientists reckon that probably between 60 and 80% of the entire immune system is actually in the gut. And that's one of the reasons why we work on getting people's digestive systems as healthy as we possibly can do, because most of the immune system is actually in the stomach and intestine, in what we call the lymphoid tissue, the GALT and the MALT, the gut-associated and the mucosal associated lymphoid tissues. That's where a hell of a lot of your immune army is, and where your clients' and patients' immune armies are stored. So if you have a problem in the gut, it can affect everything, but particularly the immune system, particularly the detoxification system as well. So with the Olympic rings health analogy, within a couple of minutes, you can explain to your clients and patients and say, look, problems in the gut, in the digestive system, can have global consequences in the body. Problems with the hormonal balance can have global consequences within the body. Problems with detoxification can have global consequences in the body. Problems with the immune system can have global consequences as well. And all the rings in the analogy are inexorably linked together. And you might also say, the thigh bone's connected to the knee bone's connected to the foot bone, or whatever it is in the song. Everything is linked together. And so we have a domino effect. If one system in the body is affected, it can affect all the other ones. This is a totally different model from knowing more and more about less and less, and focusing in on one specific area of the body, right? So back to Hompes Method. Now, imagine in your clinical practice having a proven system that enables you to determine what bad stuff is in your client or patient's body. Oh, just had a major problem with the computer there. Excuse me. Imagine being able to determine the good stuff that's missing or inadequate. Imagine being able to determine hormone, digestive, detoxification, and immune function and balance. Imagine having the toolkit to be able to do all of that. Then imagine having a set of specific recommendations to help your clients and patients remove the bad stuff, replace the good stuff, rebalance the Olympic rings, help them ascend their personal vitality scale, and then dissolve symptoms in the 7 areas of health, and then go on to completely rejuvenate their well-being and reduce the risk for future symptoms and disorders in the future, right? How does that sound to people? Well, that is exactly what Hompes Method practitioner training gives you. And it's all neatly wrapped up in a system that's client and patient friendly, you might call it patient centric, and easy for you to deliver. And so what do? Well, we have to go back to the cake analogy. So with Hompes Method, we have 2 main levels of work. We have the cake itself and the icing on the cake. So we have in Hompes Method level 1, foods, eating habits, blood sugar balance, electromagnetic fields, sleep, movement and exercise, and breathing. How can we help our clients and patients gradually introduce and optimize those main areas, particularly the food, eating habits, blood sugar balance, and sleep to begin with? Then we have the icing, which is Hompes Method level 2. We have all the functional lab testing, and then the protocols that help us cleanse and repair the gut, help the body detoxify, help the nutrient replacement and getting more nutrients back into the body, help hormone balancing, whether it's the thyroid hormones, the adrenals, parathyroid, or the sex hormones, estrogen, progesterone, testosterone. Then we've got specific organ and gland support where there might be weaknesses. And then we have brand new module for 2015, the neurotransmitter module. Plus, obviously, some guidance on when to refer out to make sure people don't have structural issues and mechanical issues in the body, and when they may have mental, emotional, spiritual stressors that are driving some of the symptoms. So intake for the next Hompes Method practitioner training, which is delivered live by me, Dave Hompes, and also my highly skilled master practitioner, Jack Walton, is now open. The package I'm offering is going to be what basically is now once in a lifetime opportunity. And I'd love to have you on board, and I'm going to talk to you about the opportunity in one final training video for you. So just remains on this video for me to say thank you. Thanks a million as always for watching this video and for watching all 4 training videos. I hope they've been entertaining for you. I hope you've got something out of them, and I hope they help you explain health and illness to your clients and patients with greater ease and efficiency. As I mentioned, I've produced another final video presentation to explain how the Hompes Method training programs work from a practical process and admin perspective. I'm going to talk to you about that very special once-in-a-lifetime offer as well. My name's Dave Hompes. You're watching Hompes Method Practitioner Training, a bunch of introductory videos to get you to know me, for me to get to know you, and for you to understand what the program is all about. And I can't wait to talk to you again next time. Thank you.